Any other questions?
We have 4 remaining, and I would ask, the first will be Millie Breeden, and I would ask the other 3, Sharon Price, Joanne Cummings, and Carla Bueno, to come on down front so we don't have so much transportation time between each of you. If you'll come down here, and Ms. Breeden, you have the floor.
Okay, I'm a Republican. I have been a lifelong registered Republican. I've been asked why I'm doing this. Why are you sticking your neck out to save abortion clinics? You want more grandchildren. There are several reasons, but the biggest reason is because I'm a Christian, and God told us to take care of the poor, the least among us. And by closing these clinics, you are attacking the poor, who are the least among us. If I sat back and said nothing, I would be an accessory to a crime before God by denying the least among us safe and access to health care. I have had so many people come up to me and thank me for standing up, including the wife of a local preacher in Gunnersville. They tell me they are not able to stand up openly, but they can do it in the privacy of the voting booth and are planning to in 2012. Women that seek treatments at the clinics don't have health insurance like you and I do. And the majority of them are not even there for an abortion, but for treatments for other concerns facing women, like preventing cancer, affordable access to birth control, and treatment for STDs. The clinics are the only solution for the least among us. Nobody wants to have an abortion, and there is nobody that is so-called pro-abortion. Do you really want teen suicide to go up? Because they are only one example of the least among us. Why do you feel the need to shame women? Because I just hate it that people shame women. Do you not realize that men have sex too? Would things be different if a man got pregnant? Women have put tears and thought into this decision. Someone yelling at them, praying out loud, throwing things in a car, and proposing a bill like trout will not change anything.
Ms. Breeden. Thank you.
Okay.
Thank you for being with us. Ms. Price.
Sharon McClendon Price. I'm from Morris County. Good to see you again, Jim. I wrote a letter, and I'll just read it. It takes but a second. Remember those darling little cards we had last year, the Say No to Personhood, the little purple ones? Well, we still do not support a single one of them, no matter what new number you gave them. We will be here in Montgomery every week doing all we can to stop these type bills, because we dare defend our rights against such asinine and ineffective legislation. Please make 2013 a year where Alabama becomes a state that supports all, and not just the foolish and idiotic ideas of a few troglodytes and misogynists, that means male chauvinists, because they had lots of money to donate to your campaigns. Remember, you represent all of Alabama, so work on something for Alabama. Oh, I don't know, say attract a new industry, thus creating jobs, paying back that big old rate on the rainy day trust fund, making sure birth control is legal and available, thus preventing abortions, and finding a way to make that crippled Beeson-Hammond Taxpayer Protection Act actually start protecting Alabama taxpayers. Is that too much to ask for? And for the love of family, leave that damn personhood bill alone, and the covenant marriage bill where it belongs, in the trash, or else we're going to have us a bunch of oranges. Got conclaves sprung up all over Alabama. Jobs, education, streamlining legal status, and staying out of Alabama's uterus. That's what we expect out of you, because we know you have no intention of rolling back that race. Thank you.
Ms. Cummings.
I'm going to give up my time. Carla Bueno from Crosstown.
3 minutes.
My name is Joanne Cummings. I'm a retired engineer and business owner from Decatur. Talk a little bit about the safety. The complication rate for abortions nationwide is 0.3%. And if a mortality rate is reflective of the overall safety of procedures, then I'd like to give you these other statistics. Nationally in 2008, the CDC reported only 12 deaths from abortion. Statistically, that is 0.6 deaths per 100,000 abortions. On the other hand, the Bureau of Obstetrics and Gynecology reported a death rate of 8.8 per 100,000 live births. This means that a woman is 14 times more likely to die from continuing a pregnancy that she does not want than from having an abortion. By shutting down clinics due to irresponsible regulations, they are condemning many more women to die because of forced births. By comparison, liposuction is reported to have a death rate of 19 per 100,000 procedures. Deaths from complications of colonoscopies are 35 per 100,000 procedures. Yet they wish to make abortion clinics subject to the same regulations that have these statistics when there's no medical need for it. So tell me, how is overregulation of abortion clinics really about women's health and safety? This bill is almost exactly the same bill as was submitted to you at HB 223 from last year's original bill. Only minor changes are made. There were a lot of amendments made on the floor of the House, and almost all of those amendments have been removed, including the provision that that the ambulatory surgery requirement be for only new or remodeled facilities. Trap law, this is considered a trap law, and it's another example of a way to present a solution in search of a problem. Dr. David Grimes, former chief of the branch of Centers for Disease Control and Prevention that monitors abortion safety, said, I can safely say with confidence that these regulations will not have a single positive impact on women's health. Having published on every hemorrhaged abortion death in the United States, I can assure you that not one single one was caused by door width. He refers to trap laws as the antithesis of good medical policy, stating that in public health we identify a problem, figure out the causes, and look for solutions and implement them. Here we see a vigorous response in the absence of a problem. It is science run amok, public health policy run backwards. Instead of working to impede safe, legal, medical procedures and using scare tactics to accomplish anti-choice goals, lawmakers should instead pass legislation that would prevent unattended pregnancies and thus reduce the need for abortion. That is the right way to improve women's health. Abortion is an extremely safe procedure. Nevertheless, having failed to make it illegal, anti-choice activists are trying instead to make it unavailable, principally by imposing onerous, medically unnecessary regimes on abortion providers. Any new proposed legislation must be carefully assessed to determine their true purpose and effect on women's health and their right to choose.
Thank you, Ms. Cummings. Does any member of the committee have any brief questions or any? And I recognize Representative Knight.
Yes, sir. Ms. McClurkin, please. I just had a couple of just quick questions. Is the purpose of the bill here to just shut down the clinics?
No, sir.
Okay. Is it to just cut out all abortions?
I wish, but it's not.
Okay, thank you.
Anything else? Representative Hubbard.
And this is for Ms. McClurkin again. I'm sorry, Mr. Chairman. Ms. McClurkin, I'm trying to understand. I've heard, sounds like 3 different answers to my original question to you about admitting privileges or staffing privileges. I think Dr. Brinson said that something similar to what Representative Weaver said, that there could be a contractual relationship. I'm not exactly clear about it, but I texted my doctor and asked him what that meant, and asked him under those circumstances what that would mean. And his response to me was, as he understands the law in this state, that an out-of-state doctor under this law would not be able to contract with a local physician who had staffing privileges. That gives me a good deal of concern, Ms. McClurkin. I'm all for ensuring that women who choose this with their family and their God, that they have the safest possible avenue for that choice. I'm very concerned that by requiring these staffing privileges, that we are cutting out a whole swath of clinics, and that we're going to put a burden on them that is unnecessary if we could only allow these physicians to contract with a physician who did have a staffing privilege. And so I have, Mr. Chairman, I'm not sure the procedure for this.
Do you have a question for Representative McClurkin?
Well, we spoke about this before the committee hearing, Mr. Chairman, and I have an amendment that would allow for these physicians to have contractual relationships with the physician who does have staff.
I believe this is back before the committee. You'd be more comfortable.
But I'm sorry, Mr. Chairman. I do have an amendment that would insert on page 7, line 21, word staff privileges, comma, or shall have a contractual relationship with the physician who has staffing privileges, comma, and at the appropriate time, Mr. Chairman, I'd move that this committee adopt this amendment.
I'd like to
Representative Henry,
table that amendment.
we have wait a minute, let's get a motion to offer the amendment.
Second.
Do you, Representative Hubbard, you've made a motion to offer that amendment, is that correct? Do I have a second? Hearing none, it dies a natural death.
I would,
Representative Henry, you're recognized.
Real quick, as far as staffing privileges from outside the state, physicians come into the state all the time in locum situations. There is extensive paperwork that is required to get staffing privileges at the hospital. There's background checks, there's proof of education, qualifications, those types of things that the physician can meet. It's not that this is impossible. And your physician that you contacted must not have fully understood your question, because we have people come in from the out of state all the time practicing in our hospitals. They just have to go through the paperwork trail just to be confirmed as to who they are and that they can do what they say they're going to do. So
Perhaps that clears that issue up, that it can be done. Probably your physicians that are licensed in Alabama have never explored the issue. Do I have a motion?
I mean, I have
Representative Lee, you're recognized.
Motion for a favorable.
We have a motion for a favorable report and a second by Representative Henry. All in favor say aye.
Aye.
And opposed.
No.
Chairman, I'd like to request a roll call vote.
You're a little late. Look, we've already had the vote. Representative Patterson, you're gonna have to jump a little bit quicker. This meeting is adjourned.